when did private equity really start to dip its toe into the healthcare industry, which is what, like 20% of the United States economy, something like that?
It is
Um,
definitely 20. It's not only 20% of the U.S. economy, but it's a significant Medicare and Medicaid, for example, are significant percentages of the federal and state budgets. So, like Willie Sutton says, why do you rob banks? Because that's where the money is. And that's why private equity is going into healthcare, because that's where the money is.
Lots of money. Unfortunately, I mean, on our show, we're advocates for single payer. So,
Let me, let me, let,
yeah,
let me answer your question, which I didn't.
sure.
Um, they did a little bit in healthcare in the 1990s and a little bit in the early 21st century. But since 2015, they've just been accelerating dramatically. And as they have more and more what they call dry powder, should I explain what that is?
Yeah, go ahead.
Okay. Public pension funds, university endowments, and nonprofit endowments, they are the major investors in private equity. And they have invested in these private equity firms. I'm sorry, I lost track of what I was.
You were mentioning how
Yeah,
what dry powder is.
yeah.
Yeah.
So they started to get more and more dry powder, which is the money that these investors are giving them, and they have to spend it. And so this money is growing and growing, and the money is sitting there. And they finally decided that, hey, healthcare has a lot of benefits to it, uh, including the fact that it's very profitable. So by about 2015, they started investing seriously in the healthcare sector.
And this is probably around the same time that some of these pension funds begin to move more into the stock market and into the investment sphere. Is that correct?
Well, these pension funds started moving away from the stock market to private equity.
Right.
Um,
Okay. That's, yes. Gotcha. Okay.
and I just read this morning that there's an average of about 14% of their, and this is just an average, of their pension fund money now is in private equity. And they keep investing more and more money.
Is it because they perceive it as less risky?
It's definitely more risky.
Right, right, but the perception might be that it's less but based on your research, it definitely seems more risky.
But no, it's definitely more risky. And another problem, it's illiquid. The private equity fund keeps this money for decades. But the reason they're investing more and more is because they believe, and I emphasize the belief, that they're getting high rates of return. There is a growing number of studies now showing this may not be the case anymore. It's very, very hard. Private equity is very secretive. It's very hard to get any information, including the investors get very little information.
Right. Well, you were struggling to get anyone to kind of give you more information for your research as well on this side. I know you wrote a bit about how secretive they were in you trying to get in the process of your research.
Well, they make all of the businesses that they buy sign non-disclosure and non-disparagement clauses, and at the risk of losing the money that they were given. So people are very, very reluctant, obvious reasons, to talk about the problems that they experience once they've sold their small business. A lot of these small businesses in healthcare, whether it's autism or eating disorders or drug and alcohol rehab centers, a lot of the original owners really care about the issue. and really care about their patients. And they don't understand. There's a lot of naivety among physicians, for example. They don't really understand what they're getting into, because they're told that what the private equity firm is going to do is take care of the annoying stuff. And there's lots of annoying stuff with rules and regulations and handling, patient times that they're coming and all of that. That's all going to be taken care of by the private equity firm, so as to allow the, let's say, physician or provider to practice what they want to practice. It's a big thing. They let physicians practice medicine. But the reality is they are totally controlled by the private equity firm.
Can you expand a bit on the point about how private equity is targeting places like eating disorder centers, rehabilitation clinics, autism treatment facilities, because there's a little bit less government oversight into some of those facilities, and they've, I think, been, and correct me if I'm wrong, targeting them for that particular reason.
Well, one of the reasons that they're targeting healthcare, obviously, is because that's where the money is. That's where the profits are. The aging population, the Affordable Care Act, which put more patients on the, but also healthcare is fragmented. I mean, lots and lots of small agencies, mom and pop shops, that what they'll do is they'll buy what they call a platform, like a flourishing company.
Mm-hmm.
And then they will add on to that company by taking on these small mom and pop shops or agencies, buying those companies and making it larger and larger, which increases the value exponentially, but also gives them local, regional, state, and sometimes national monopolies, so that they can control the costs.
Gotcha. And
can I just say one thing, which if
sure.
I don't get in, it won't, because this is one of the most important things. When they buy a company, the private equity firm puts in about 2% of the value, only 2%. The pension funds and endowments put in about 38%. And the rest of that is paid for by debt. Now, the debt is paid back by the companies they bought. So whether it's the large company, which is the platform, or the add-ons that they buy, it's the companies, not the private equity firms, that pay back the debt. And I think it's important to understand that.
So if I'm not mistaken, that seems like a much shakier business model than advertised, right?
Oh, yeah. Oh,
like
yeah.
That's a crumbling foundation. I mean, I don't want to say it's robbing Peter to pay Paul, because that's a little bit too extreme. But no, it's not.
I don't know if it's too extreme.
Okay.
I mean, they're going out and buying this company, and then telling the company they have to pay back their own debt.
Yeah.
And by the way, that's why they need a flourishing company. But I think the significant piece is that in order to pay back this debt, they have to make huge cuts to increase revenues.
Right.
And that's where it gets very, very scary in healthcare. For example, they'll speed up the intensity of care. So the physician who used to treat 10 patients now has to treat 15 patients an hour. They'll cut back on materials, which, of course, is a big deal in healthcare. They'll cut back on training. They'll even cut back on the number of physicians and put in less trained substitutes. They'll have these untrained people without a lot of supervision. I mean, there's all kinds of things that they do to increase revenues so that they can pay back this debt. And then they sell the company 5 years later. And now they own a company with no debt, for the most part, but lots of value.
Yeah. I mean, I have a theory that this is also happening in tech right now. That a lot of these companies that are trying to get acquired, they're cutting costs very quickly so that they can sell their brand and get a big payout for the executives, and then the company is gonna get acquired, and the workers, it doesn't necessarily matter. I mean, I want to return to how this affects the patients in a second, but workers in these fields in healthcare are also affected by this as well. And can you just expand on the layoff element when they're trying to make the company as profitable or as squeeze as much juice out of it as possible?
Well, yeah. I mean, they'll have fewer workers, of course, fewer high-paid workers like physicians. They'll often slash the salaries. They'll slash benefits, slash sick days. So it has a very detrimental effect on the workers
Right.
in healthcare. And as a result, the patients, because in many healthcare fields, it's the workers that are really there for the quality of care. When you start messing around with the workers in healthcare, if you mess around with the workers in retail, so it's annoying. You go to the store and you can't get someone to help you. But in healthcare, it can cause illness and death. So it's a pretty different issue.
Absolutely.